for joining me for ACEP's Capital Minute, a look at what's happening in Washington right now that's affecting emergency physicians and patients. I'm Laura Worcester. For the next 30 or so minutes, I'm going to give you an update of what's happening in our nation's capital, and then we'll open it up for questions. You can submit them at any time by using the Q&A feature at the bottom of your screen in Zoom, and then I'll answer them live after my update. Today, we'll start out with a closer look at the 2020 elections and an overview of our NEMPAC activity this year. Then we'll cover some recent regulatory updates, and we'll discuss what's happening on Capitol Hill, including our COVID-19 advocacy efforts. Now that we're a few weeks out from the election, we can take a deeper dive into the election results and our NEMPAC activity. Currently, former Vice President Joe Biden has 306 electoral votes, while President Trump has 232. As a reminder, a candidate needs 270 to win. We're still awaiting a recount in Georgia, which has 16 electoral votes, but currently VP Biden is leading in the state by several thousand votes. Major news outlets have declared former Vice President Biden the winner, but President Trump has yet to concede, and we're waiting ascertainment from GSA to formalize transition of power. In the Senate, Democrats picked up 2 additional seats with wins in Arizona and Colorado, while Republicans picked up a seat in Alabama. Currently, the breakdown stands at 50 Republicans and 48 Democrats, with 2 races outstanding in Georgia. On January 5th, Republican Senator David Perdue will face Democratic challenger John Ossoff in a runoff election, and the state will also hold a special election with Republican Senator Kelly Loeffler, who was appointed to the seat in January to replace Senator Johnny Isakson, who had retired early for health reasons. She'll be facing off against Democratic candidate Raphael Warnock. Until then, control of the Senate remains unknown. If the Senate goes 50-50, the vice president, who at this point is presumed to be Kamala Harris, would be a tie-breaking vote. In the House, results currently stand at 219 seats held by Democrats to 204 Republican seats. This leaves 12 races still outstanding that are still being determined to reach the full 435 seats. Democrats are expected to maintain control of the House of Representatives with a decreased majority. And depending what happens to those 12 pending races, Democrats could have the smallest majority in the new Congress since Republicans had 221 seats 2 decades ago. So how did NEMPAC play into this? NEMPAC had donated a total of $1.65 million to federal candidates, party committees, and independent expenditures for friends and champions of emergency medicine on both sides of the aisle. Of the 197 candidates NEMPAC supported in this election, 17 lost, mostly in primaries, with another 7 races that are still undetermined. NEMPAC supported 21 physician candidates in an effort to ensure your interests are represented and protected in Congress in the years ahead. There are some new healthcare rules and regulations coming from the Trump administration that affect emergency medicine. In early November, the Trump administration put out another major regulation that doubles down on its ongoing effort to promote price transparency in healthcare. The administration had already finalized requirements targeting hospitals, but the new reg released last week is focused on health plans. Under the rule, starting in 2022, insurers will be required to make detailed pricing information available to the public, including negotiated rates between the plan and in-network providers, historical payments to and billed charges from out-of-network providers, and in-network negotiated rates and historical net prices for all covered prescription drugs. Starting in 2023, health plans will be required to offer an online shopping tool that will allow consumers to see the rate negotiated by the provider and plan and an estimate of their out-of-pocket costs for 500 of the most shoppable items and services. Then in 2024, health plans will be required to offer online shopping tools showing the cost for all the remaining procedures, drugs, durable medical equipment, and other services. ACEP had submitted comments on the proposed reg earlier this year. Unfortunately, the final reg does not address our request to implement more targeted policies for emergency versus non-emergency care, including our recommendation to require health plans to provide consumers with information they need to fully understand their cost-sharing obligations for emergency services at the time that they obtain coverage. Possibly our biggest concern was that the initial list of 500 shoppable services that health plans must include in their online shopping tool includes emergency department E&M service level codes 99283 to 99285. ACEP, of course, does not consider these services to be shoppable since individuals do not have time to shop for providers when they are experiencing a medical emergency. Then last week, CMS put out the 2020 Medicaid and CHIP Managed Care Final Rule. The rule provides more flexibility to states on how they can manage their Medicaid managed care programs. Of note to us, the rule changes minimum standards that states must use to develop their network adequacy requirements for Medicaid managed care plans. ACEP had submitted comments on the proposed rule requesting that CMS specify emergency physicians as a specialty type that states would be required to include in their network adequacy standards. Unfortunately, CMS did not adopt this request in the final rule, instead deferring to states on which specialists to include in their standards. On a separate note, we did recently receive some positive news from Pfizer, Moderna, and the FDA in the ongoing efforts to combat COVID-19. While these announcements are a great first step, the road ahead to ensuring the safe and effective distribution and administration of COVID-19 vaccines and therapeutics is going to be long. It will be essential going forward that you as emergency physicians understand not only the clinical effectiveness and appropriate use of these vaccines and therapeutics, but also the rules and payment mechanisms that are associated with them. In other words, we need to have solid regulations in place that will mitigate confusion and ensure smooth distribution and administration processes. HHS has already issued some useful regulations and guidance around vaccines and therapeutics, but more will likely be necessary going forward, and ACEP will work closely with regulators to ensure that emergency medicine needs are represented. Switching gears, there are some recent legislative updates on bills that ACEP has supported, along with our federal COVID-19 federal advocacy efforts. On Tuesday, the House approved 2 ACEP-supported bills by voice vote related to substance use disorder treatment and violence prevention. The first bill, sponsored by emergency physician Dr. Raul Ruiz from California, is HR 2281, the Easy Medication Access and Treatment for Opioids Addiction Act. This legislation that ACEP has worked closely with the office to develop would allow practitioners to dispense up to a 3-day supply of narcotic drugs at one time to an individual for the purpose of maintenance or detoxification treatment. This would eliminate the requirement that patients suffering from acute withdrawal symptoms would need to return to the ED each day during that 72-hour window while they await arrangements for long-term narcotic treatment. HR 5855 is the bipartisan solution to Cyclical Violence Act. It's sponsored by Representatives Dutch Ruppersberger from Maryland and Adam Kinzinger from Illinois. This would create a grant program at HHS to support trauma centers with violence intervention and violence prevention programs. Program support would be provided to conduct research to reduce the incidence of re-injury and reincarceration caused by intentional violent trauma. Given the recent surges across the country and the progress on the vaccine development front, ACEP has been hard at work to ensure you have what you need to handle this next wave. We've updated our policy priorities that guide our advocacy efforts. You can check these out using the link on your screen, but in the meantime, it covers areas such as securing and protecting an adequate workforce, ensuring adequate resource allocation, and providing access to care for those infected or suspected to be infected, including our recommendations to ensure that you as emergency physicians have the information and resources you need to effectively and safely receive and administer COVID-19 vaccines. While we continue to advocate for frontline financial relief, there has not been serious headway made in terms of passing the next COVID relief package that this would be part of. While Majority Leader McConnell had signaled that he was open to passing another package shortly after the election, his proposal remains very narrow, and he and Democrats in the House do not see eye to eye on the right level of financial relief, which has left these conversations in limbo with very little hope of a deal being reached before the end of the year. Also on our COVID microsite on acep.org, we are rolling out a new spokesperson toolkit in the coming days, which will include talking points and sample social media posts to help you communicate with policymakers and patients and the media about key issues, including encouraging people to continue safe practices during this next wave, including social distancing during the holidays and wearing a mask, reminding the public that the ER is the best place for emergency care, whether it's related to COVID-19 or not, physician mental health, ongoing PPE challenges, and issues related to testing and the supply chain. That wraps up our federal advocacy updates. So I'll start taking your questions. Remember, you can submit them using the Q&A feature of Zoom on the bottom of your screen. See what questions are coming in. Now that the votes are mostly counted, is this election a win for emergency medicine? That's a good question. I would say that it's sort of a wash if I had to really gauge it. I think given that it remains a divided, most likely will remain a divided Congress with a presumed to be Democrat coming into the White House, what will probably be a Republican majority in the Senate, and then a Democrat, but a narrow Democratic majority in the House, it doesn't leave a lot of room for some of our legislative priorities to move forward. So there's going to be a lot of deadlock. So it might be hard for us to get some of our stuff through, kind of as it were. On the other hand, sometimes this could be helpful in a way, because if it had been one party, for example, controlling all three basically arms of that, you could have a lot of things pushed through, some of which would probably be helpful, but others that may not be helpful to emergency medicine. And that would create a lot of, I think, work and concern in terms of trying to fend off some damaging things. So I would say congressionally, in terms of the election results, probably we're at a wash right now. And really it'll remain to be seen what happens in January with the runoff elections, since I think that's going to color some of the kind of bipartisanship or non-bipartisanship, depending on where kind of emotions land afterwards. And I think that will kind of signal whether or not it'll be a productive Congress or just mostly deadlocked Congress. So another question is, we heard that Biden named a COVID task force. Is emergency medicine represented? Actually, yes. So the presumed incoming Biden-Harris administration has started to form their transition teams. And also along with those efforts, they put together a task force on COVID-19 specifically to inform kind of their preparations before taking office. And there is an emergency physician that is part of that task force, Dr. Robert Rodriguez from UCSF. And so we're really pleased to have the specialty represented, and ACEP itself is also working with some representatives in the transition to make sure that they're aware of the unique needs emergency physicians and patients have, both with regards to COVID-19 and the overall healthcare systems. And so I think that's something that tends to get lost. We're pretty used to, when new members of Congress come in, educating them on emergency medicine's key issues, but we also need to explain kind of how the overall system works. A lot of members of Congress and their staff, even after years in office, still are surprised when we point out to them, once again, that a lot of emergency physicians are not directly employed by the hospitals in which they're practicing. They might be part of groups, small and large, and therefore it's a different type of system, and you can't just assume that something that happens to a hospital flows down to the emergency physician. And we've seen a lot of the kind of indirect damage this caused with the Provider Relief Fund, the COVID-19 Provider Relief Fund that Congress passed sometime in, I think, April. It's been a while, sorry. And that money was supposed to go to providers, given the name Provider Relief Fund. And we had to do it kept being called the hospital fund after that by the very members of Congress who passed the legislation, and by the HHS officials that were tasked with implementing it. And so it was just assumed that if money went to the hospitals, which the first few rounds did, that emergency physicians will also get anything they need. And that definitely isn't the case, just because of the way their business model often works. And so we really had to highlight the significant impact a lot of emergency physician groups had faced due to volume drops, which was another thing that was really counterintuitive for policymakers to understand. I mean, we literally had to make graphs and show them actual numbers compared to 2019 for it to really hit home that volumes did drop significantly, even back in March and April, with people avoiding the emergency department just because of lockdowns and because they were scared to come to hospitals and potentially be exposed. So I think that all of that is kind of a natural byproduct of people not understanding where emergency medicine fits into the system. And so that's something that we continue to reiterate and educate over and over again policymakers, since it doesn't always stick with them. Another question, will these new regs focused on health plans be enough to meaningfully impact cost sharing or prices? That's an interesting question. I think it remains to be seen. I believe the health plans, if not the hospitals, I honestly don't remember which, are still challenging this with lawsuits against the administration. I think with a change in administration, it's unclear if this will still be something that's carried over. Once a regulation is finalized, a new administration can't just like undo it like with like a wave of a pen, right? They can put out a new proposed rule, which has to go through the comment process, and doesn't necessarily mean it will be, come out the same way. And to really radically change something, they actually need Congress to direct that, and then they can put out a new proposed rule to really change things. There's the Congressional Review Act, which for certain regulations above a certain financial threshold, Congress can use to undo regulations, but I think there's very little likelihood that Democrats at least would have enough votes in Congress to really use that meaningfully for a lot of the rules that they disagree with in terms of the Trump administration. So I think this one's probably going to stick around at least for a bit. I think depends on if provider or insurer lawsuits to block this carry through. If they do, I mean, it could at least slow it down a bit, but whether it'll meaningfully impact cost sharing or prices, I think they could impact somewhat consumer understanding of how cost sharing works. That comparison tool that insurers will be required to have will at least show out-of-pocket costs for consumers. Hopefully it'll be done in a way that actually makes sense to consumers, because I think we've all seen EOBs, or those explanations of benefits that are supposed to explain your benefits as a consumer when you receive services, but they're anything but good explanations. They usually confuse people even more. So I think once those tools are up, hopefully people will start to understand what having a deductible means and how it impacts their costs once they start trying to shop around. On the downside, obviously, we're concerned, as I mentioned, about the fact that the level 3, 4, and 5 emergency medicine codes are included in the shopping tool, which is kind of ironic because obviously you can't shop around if you have an emergency that's severe enough to be coded as a level 3, 4, and 5. So that's something that we'll continue to try to highlight the problems with, and potentially there'll be a way, hopefully, to at least flag in the comparison tool that if somebody is worried about an emergency, they need to just go to the nearest emergency department and not stick around online shopping around comparing codes. So we'll keep up on that. Got another question, which is there an update on the proposed cuts facing emergency physicians in January? Yeah, so I think last time that we met, which was November 4th, Congressman Barra and Bouchon, were both physicians in the House, had introduced bipartisan legislation to hold physicians harmless from cuts due to those proposed Medicare E&M cuts that are coming in January. So they had previously led a congressional sign-on letter that over 200 members of Congress had signed on to, supporting that same concept, and they put out their legislation doing pretty much the same thing. We're still working to build co-sponsors on that. I believe it's up to 28 co-sponsors right now in the House, so that's a little low for our tastes. We're also working on getting the Senate to take similar action, and hopefully most of you saw the email that ASAP sent out, I think mid-morning today, asking you to contact your senators and ask them to take action to stop these cuts. We're trying to continue to highlight how very damaging these cuts would be, especially right now as we're facing second, third, fourth, whatever you want to call it, wave of COVID. And with the holidays coming up, that's only going to be expected to get worse. So everybody needs the resources they can to continue providing care. So that's kind of where that remains. The additional step that's coming on this is that, a lot of congressional offices we speak to and committee staff or leadership are also waiting for the final rule that will bring out these cuts to be released. And that's expected to come out by the end of the month. We don't know the exact date, but I think statutorily it has to be before December 1st. So probably it'll be coming out if CMS maintains its sort of track record. They usually like to do it on a Friday and right before a holiday, or sometimes during Thanksgiving week, so that's always fun. So we're expecting it then. And so those congressional offices have been waiting to see that before they'll take action, or they at least have been saying they're waiting to see that before they'll take any action. So once we have that, we'll be able to kind of go back to them and say, like, see, this is what the final rule says. This is the exact impact it's going to have. Now we can calculate those. You know, you need to stop this. So that's what's really going to be happening on that. ACEP is ready and is already working to have some targeted meetings with committee staff and congressional leadership and some key members of Congress on this issue for the week following that first week of December, presuming that we'll have the final rule by then. And so what we're hoping to do is be able to go back to them and talk to them about what's in the final rule and encourage action. The kind of tricky part on all of this is, like I said, the final rule comes out by December 1st. The previous funding of the government that was passed earlier this year expires on December 10th. So there's a really narrow window for Congress to do something, right? So our understanding is there's obviously already discussions about this. Certainly there's a huge amount of awareness. Every congressional office we talk to about this it has definitely talked about how many other medical societies they're hearing from about this issue, since other specialties are impacted as well. So it's not a matter of lack of awareness, even with your kind of current rank and file like offices. This is just a matter of leadership at this point, figuring out what they want to do and us helping to inform those efforts with regard to some of the different options and what the impacts would be on that. So stay tuned. When that final rule comes out, that's kind of going to be the trigger for our next wave of efforts. Please take action on that alert that went out today. If you didn't receive it directly, you can always go to acep.org and go to the federal advocacy section, and you'll be able to navigate to our 911 network and take action there. So that's kind of where that issue stands. In terms of if there's other questions. Yeah, so the MAT bill is a big development. Can we expect additional movement related to the X waiver or other ACEP asks? For sure. So the MAT bill is something we've been working on for a long time. We've also been working with the administration for a while on trying to get some relaxations of the X waiver, at least within their authority, without requiring congressional action. So the two kind of efforts have been running in parallel for us. We've been advocating heavily. You know, we're also advocating heavily to get rid of the X waiver altogether. But if that's too kind of tall a hill to climb for Congress, at least we can do some of these more scaled down relaxations that at least provide patients who are in the ED with a substance use disorder or overdose with some immediate relief and enough of a kind of supply of relief for a few days before they can get into community services, since that can take a while and isn't always something that you can jump right into after being in the emergency department at 2 a.m. on a Saturday night, let's say. So that's definitely something we're working on. Another ACEP ask is around our provider or physician mental health needs. And we have the Dr. Lorna Breen Healthcare Provider Protection Act that we've talked to you guys about a bunch on past Capitol Minutes. And we're hoping for some movement related to that. If there were to be a COVID package before the end of the year, it would be much more, I think, not certain, nothing's ever certain in Congress, but it would be much more likely that that would be included. There doesn't look to be a COVID package coming before the end of the year. So we're still pushing to see if there's a way to have that advance even in the year-end omnibus funding package, which is kind of a stretch, but certainly worth trying. And if not, early next year, we can expect Congress to actually do a COVID package, hopefully right away in January. So we would definitely be pushing those priorities at that time. All right, another question. Is a surprise billing solution still on the table? And should we be concerned about a legislative fix or executive action? So surprise billing's always kind of still on the table. In terms of concerns about a legislative fix, I think we updated you all a couple weeks ago or a couple Capitol minutes ago that Senator Cassidy had joined with Senate Health Committee Chair Alexander and Energy and Commerce Chair Pallone, Frank Pallone, joining in a compromise with their legislation, which ASAP had opposed, and his, which was a little more favorable. And so they've combined that. It's somewhat less bad than the original Energy and Commerce Health Bill, but we still have a decent amount of concerns with this compromise approach. We haven't seen legislative language yet. We have been told we would see that by the elections. That seems to have slipped. But our understanding is conversations are still ongoing, and there are some discussions about whether that could be included in a year-end package. I think it sort of depends on how the overall negotiations for a year-end package get, because surprise billing is controversial, obviously, and so if the negotiations are already kind of precarious and trying to reach agreement on stuff, throwing surprise billing in there could make that even harder, in which case congressional leadership may want to leave it out. That being said, this is, I think, sort of a long-standing issue that Congress has been working on for over 2 years and 2.5 years. So I think there's also probably a desire to get it off their plates and just be done with it and be able to start the next Congress with kind of a clean slate. We just ASAP participated last week in a meeting with about 7 or 8 representatives from the Congressional Doc Caucus. And we talked about surprise billing and our concerns with that compromise proposal and really what needs to happen moving ahead. And that was a really good discussion. ASAP was on it with, I think, about 5 other specialty societies. So it was a nice small group. And we had a lot of FaceTime with all these members of Congress. And so that was really productive to help inform their thinking on it, since leadership may turn to the Doc Caucus for help on surprise billing. All right, last question, 2 minutes to go. You mentioned updated policy priorities and an advocacy toolkit. Can ASAP help with local media outreach? Yes, absolutely. ASAP can help you with local media outreach. I'm sure you all have your local medias covering COVID, just probably almost 24/7, and they need content experts to turn to. Sometimes, I'm sure you've seen, some of those experts are not always actually experts. So we would love for more ASAP members to reach out and be a spokesperson to their local media to provide really just credible, science-based kind of input on their coverage of COVID-19 and the pandemic, and what patients need and what you all need as physicians. So you can contact pr@asap.org if you want to discuss writing an op-ed, which we can help you with some samples with, so letters to the editor, social media, or any other external communication questions, please reach out anytime. You can also see the toolkit, which is on the ASAP COVID Info Hub, which is at asap.org/COVID-19. And you can see download the toolkit there. Take a look at it. If you have any questions, again, just email pr@asap.org. So with that, in the last minute, we are rounding out the thing. And I should say the toolkit's not quite ready yet, but it should be up there by the end of the week. So definitely check back shortly for the most updated toolkit. So with that, we're closing out the half hour. So thank you again for joining us. And we will see you in a couple of weeks on the Capitol Minute. Thanks again.